in various areas and categories. All of you would be aware of these, and the manner in which GAPIO has turned this year in every aspect of its functioning demonstrates its dynamism and the fact that it is quickly reaching it is not easy to sign in on a weekend, but it is indeed much easier than traveling thousands and thousands of miles to witness this awards function. I congratulate each of the awardees, and I wish you the very best and wish that you continue your good work and welcome you to this function. All of you who are attending this function from various parts of the globe, thank you indeed for being here and for participating. And we look forward to sustained participation in this and other activities that GAPIO has so elaborately planned in the past several months and will continue to do in the coming months. Welcome and thank you.
Thank you very much, Dr. Jairam. I have immense pleasure now, ladies and gentlemen, in inviting the visionary founder chairman of Apollo Group of Hospitals, Dr. Pratap Reddy, who harnessed technology and insurance to take healthcare to the masses. Widely acknowledged as the architect of modern healthcare, Dr. Reddy has dedicated his life to bringing world-class healthcare within the economic and geographic reach of millions. May I request Dr. Reddy to make the opening remarks, sir?
Good evening, Honorable Minister of Health and Family Welfare, Dr. Harshvardhan ji, Dr. Anupam Sibal, the President of GAPIO, Dr. Nandakumar Jairam, Dr. Sudev Parekh, Dr. Sankarao, Dr. Ramesh Mehta, who all made this possible 10 years ago. I really admire our collective effort at that time to looking back over the past decade. I also welcome Dr. Ravi Kohli, Dr. Suresh Reddy, members of the Executive Committee, members of the President's Council, members of the Organizing Committee, and the various other speakers who have participated during this 2 days conference, and the sponsors of the various participants and the participants from all 53 countries. It delights me to see all 53 countries have participated in this lovely conference all through the year. I must admire the great work that GAPIO has done in bringing people together in facing a challenge which we have never seen in our lifetime, COVID-19. I still recollect vividly the April 11 conclave which was held to see what each and every country should do or can do at that moment. I think all that we can say is the various contributions from the speakers around the world and mostly the governments across the country. I must say I feel very proud that what the Indian government has done. Our Prime Minister went several times to warn people to take effective steps. Our Minister of Health, who is kindly considered to be the guest of honor today, he has played a very significant role, in immediately bringing a discipline and a working attitude in the private sector, public sector, and how these two together could work and make a very significant impact in managing people from a disease which caused severe panic across the world. But I think, as we admire the doctors, the nurses, the paramedics, the superheroes who played a great role, I must only say we also admire the great effort and advice given by a number of speakers who are willing to participate in the GAPIO's the conferences at various times to do this. So all that we can say, we would like to place our sincere appreciation and gratefulness for all who work so hard, even facing the severe crisis themselves, and their families who allowed them to do this and admire them. So I think our greatest appreciation for them. And what I would want to convey is there were several efforts that GAPIO has done during the course of the year, bringing the various speakers across the country and the councils to make it what each country can do. And I think this is where 10 years ago, a decade ago, when we started with the GAPIO, our intention was what can doctors across the Indian doctors across the world, how can they work together for a healthier and happier world? But we never thought that they would have to challenge this COVID-19. I admire everybody who has participated in this. Truly people who the deaths will be from non-communicable disease around the world, and the cost burden for the world will be $30 trillion, and for India it's going to be $3.8 trillion, which is almost 50% of the GDP. Can we afford this? But even if we can afford it, I feel that we can't, the families cannot afford. Because the people who are affected by these NCDs, whether it's heart attack or stroke, especially in the Asian continent, it's a younger age group. It used to be 30 and 50. Now the heart attacks and strokes are happening between 25 and 40. Similarly with the cancer. I'm happy now. There are several, the interactions with many wonderful. The world is at least ready to face this problem and say, how can we not deprive the young members of the family who would have lost their dear one, people on the cost burden of it. But I'm also happy that GAPIO played a significant role on the 4 new developments that will be available for the healthcare during this decade. Artificial intelligence, digitization, automation, robotics. I think these 4 will play a very significant role. I'm very happy with Dr. Anupam Sibal and his team during the course of this year, having brought saying what at each one of these, how it could be adopted and which can make a significant impact in welfare of people, and especially in managing in the NCD. I'm so happy. I've now come to my village. We have adopted, we're looking at the health of 70,000 people from the first grade to the last grade. I'm happy to say, in the last 3 years, the effort that has been done has made a significant impact. Number one, there is no cancer death there. They are diagnosed 18 cancers, 11 in women, 7 in men, all in stage 1, stage 2, and operated their well. Similarly, the hypertension, the blood pressure, they've all been under control. The Harvard gave them, a great appreciation of the work that has been done. I think this is what I want that to happen. What is happening for 70,000 people? Can we take it for 7 billion people in the world and make the country healthy and happier? And I think this is the aspiration of GAPIO. This is what we have done. I'm very happy. Our Honorable Health Minister is here. He would give us that extra fillip. He's made a significant impact during his time as Minister of Health and Family Welfare in bringing up the healthcare services of our country. Health education of the country is a great reform, and more importantly, in training people to face a great challenges like this. My sincere admiration. I thank all the delegates who have participated in this. I hope we'll all make the world a better place and a healthier place in the world. God bless you all. I love you all.
Thank you very much, Dr. Reddy, for those wonderfully warm words. That we know that you are still connected to the people around you, and your vision will guide us further. Thank you for your continued guidance and your stewardship. I'd like to now request Dr. Anupam Sibal, the Group Medical Director and a Senior Consultant Pediatric Gastroenterologist and Hepatologist, and the current President of GAPIO, to please address the gathering.
Namaste. It's 4:45 a.m. in Vancouver and LA, 7:45 in New York. Good morning to our colleagues in North America. It's 11:30 in London, 12:30 in Europe. Good afternoon, colleagues. It's 6:15 in Delhi, 8:45 in Singapore. Good evening to our friends in Asia. And it's well past bedtime at 11:45 in Sydney. We are often heard saying, I am so proud to be an Indian. What is it that we are so proud of? Or what can we say that we can be proud of? Actually, a lot. In our 8,000-year rich history, we have never invaded any country. We are the largest democracy in the world. In our last election, 603 million Indians voted, which is more than the combined population of 5 of the 7 G7 countries. What can be a bigger testament to the vibrancy of our democracy that for one voter, Mr. Darshan Das, deep in the Gir forest, the Election Commission has been setting up a polling station since 2014. We're a secular state with 1.35 billion people who believe in 9 religions. We have 22 official languages and 1,652 dialects. We have the world's largest biometric ID program. 1.28 billion Aadhaar cards have been issued. The Statue of Unity is the tallest statue in the world. We've launched satellites for 34 countries, including the United States. We have the ability to launch more than 100 satellites in a single mission. We also have the ability to bring down a satellite should the need arise. Our Mars Orbiter mission was the first mission in the world to reach the orbit of Mars in its maiden attempt. We understand frugal innovation. The film Gravity cost $100 million to make, but our Mars Orbiter mission cost only $74 million. India has progressed remarkably. We now have 761 million internet users, from less than 10 million phones to 1.7 billion phones, from 2 television channels to 902 television channels, from 2 airlines to 39, from $6 billion in foreign exchange reserve to $585 billion. We are the world's 3rd largest economy in terms of purchasing power parity. Remarkable progress has also been recorded in healthcare. Our life expectancy has gone up from 32 to 69. MMR has gone down from 2,000 to 113. IMR from 145 to 28.7. From 19 medical colleges, we now have 562 medical colleges. From 47,000 doctors, we have 1.2 million doctors. From 1,000 MBBS seats, we have more than 84,000, and we produce more doctors than any other country in the world. We have more than 44,000 postgraduate seats and more than 3,500 super specialty seats. The Pradhan Mantri Jan Arogya Yojana is the world's largest sponsored health insurance scheme that looks after 500 million people. If a procedure is done anywhere in the world, well, it's done in India with outcomes comparable. More than 2.2 lakh or 220,000 joint replacements, more than 200,000 open heart surgeries, 10,000 robotic surgeries, and 10,000 solid organ transplants take place in India each year. The new PM Atmanirbhar Swasth Bharat Yojana has been launched to improve health infrastructure. And let's look at COVID-19. India has among the lowest mortality rates, from 0 to 500,000 PPEs in a day. 70% of the world's COVID vaccines will be provided by India. And in our first phase of vaccinating 300 million, we are just 30 million short of the entire population of the United States and 30 million more than the 4th most populated country in the world, Indonesia. And that's just phase 1. Patients from 125 countries now visit India for treatment. 177 nations have started recognizing 21st June as the International Yoga Day. Indians can be found in all but 3 countries of the world, and wherever we go, we leave an indelible imprint. There are more than 200 PIOs who occupy leadership positions in government, including Ms. Kamala Harris and Mr. Costa. Indian Americans are the most educated and affluent among all racial and ethnic groups in the US. British Indians are barely 2.5% of the population, but make up 18% of all doctors. They say you can go out of India, but India doesn't go out of you. Everyone's heart beats for India. Everyone wants to be a part of the transformation that India is witnessing. Drawing inspiration from what Gandhiji had said, Dr. Reddy, Dr. Sanku Rao, and Dr. Ramesh Mehta established GAPIO in 2011. There are several programs that have been running effectively, from health checks across the country to charitable clinics, nutrition programs, eye screening camps, training workshops in leadership, clinical knowledge development programs. GAPIO has met 10 times in India, and we've had 9 international conferences in 5 countries. The Global Indian Physician COVID-19 Collaborative was established with the support and collaboration of API. I'm so delighted that today we have Sudhakar, Suresh, Anupama, Ravi, Sanku, who played a phenomenal role in establishing that, as it was in Suresh's presidency that it was established. We have our colleagues from BAPIO led by Ramesh, we have Arun from SINS, we have Aimja, we have Kapi. So this is a true collaboration, and we were so happy that we got words of wisdom from Sadhguru, from Sister Shivani, and from His Holiness. We were privileged to receive a message from the Honorable Prime Minister Shri Narendra Modi ji encouraging GAPIO and our work. And this year we launched the prestigious GAPIO Awards. Brothers and sisters across the globe, India beckons you. There's going to be a new India, an India which is going to be TB free in 2025, where there will be water for everyone by 2024, and India will become a 5 trillion economy. So come, become a part of this new India. And the next time when someone asks us, are you proud to be an Indian? The answer should be a resounding yes. And let's throw in some data, because where would the world be without zero? I'm proud to be an Indian. Jai Hind.
Thank you very much, Dr. Sybil. That was excellent, fabulous overview that you gave us. And yes, we're all proud to be Indian, and we are proud to be part of GAPIO. And we're really happy that you've shared the vision forward for GAPIO. Ladies and gentlemen, after having heard Dr. Sybil and him draw out the picture that is India, I think we all are delighted that our chief guest, the Honorable Union Minister for Health and Family Welfare, Science and Technology and Earth Sciences, Chairman of the WHO Executive Board, the Honorable Dr. Harshvardhan, has sent us a video message despite his busy schedule. He's an ENT surgeon by profession. Dr. Harshvardhan has had a long and distinguished record of public service, having joined politics in 1993. And currently, Dr. Harshvardhan is spearheading India's fight against the COVID pandemic and also steering the vaccination drive across the country. So let's listen in to the Honorable Minister for Health, Dr. Harshvardhan.
Ladies and gentlemen, greetings to all of you. It is indeed a great privilege for me to address this Global Indian Physicians Congress organized by the Venerable Global Association of Physicians of Indian Origin. It is truly heartening to note that delegates, including some of the most eminent physicians from over 53 countries, are participating at this virtual event. I would like to express my sincere appreciation for GAPIO, which since its inception in 2011 has endeavored to bring 1.4 million physicians of Indian origin across the world on a single platform to facilitate exchange of knowledge, skills, and research. This noble association is a shining example of the talent and caliber of Indian physicians who have made remarkable contributions in various fields of medicine across the globe. This past year, as the world faced the unprecedented crisis of COVID-19, it has been our doctors, nurses, and healthcare workers who have cemented their position as the foremost champions of humanity, saving humankind as it was staring at an existential crisis. I salute their courage, valor, and selflessness in serving the society. No words are enough to express gratitude towards all the corona warriors who risked their own lives to save the lives of others. It's unfortunate and a great personal loss for me that so many of them lost their lives during this time. The year gone by has also been marked by collaborations at a pace and scale never seen before in the world's history. I appreciate how GAPIO established the Global Indian Physician COVID-19 Collaborative to continuously share their knowledge and experiences to arrive at the best possible approach for management of COVID-19. The collaborative spirit and resilience exhibited by all sections of the society has been extraordinary, which has helped us overcome various challenges posed by the pandemic. COVID-19 accentuated the need to quickly transform and adapt to change like never before. The government, under the visionary leadership of Honorable Prime Minister Shri Narendra Modi ji, did not waste even a single moment in tackling the pandemic. As the news of an emerging pandemic spread across the world, we were among the first ones to have sprung into action, forming expert committees, issuing guidelines with continuous monitoring of the situation, and evolving strategies to mitigate its impact. It has been a result of our preemptive, proactive, and graded approach that India has been able to perform well on various parameters related to COVID-19. We have continuously maintained one of the lowest fatality rates and highest recovery rates across the world. Our scientists have done remarkably well, working round the clock to provide us with 2 vaccines which are being indigenously manufactured and have been approved for emergency use in India. The world's largest vaccine drive is underway in the country and is moving forward at a rapid pace with more than 1 crore doses administered already. And what is a remarkable endorsement of our spectacular talent and capabilities, India, which is often referred to as the pharmacy of the world, is now also emerging as the COVID-19 vaccine manufacturing hub of the world. Even with all the attention directed towards managing COVID-19, our government did not lose sight of ensuring continuity of other essential health services. Various policy interventions as well as use of technology like telemedicine services played a key role in this regard. Our e-Sanjeevani platform has recorded millions of doctor-patient consultations in a short span of time. Ours is a government which doesn't believe in resting on its laurels. We are now working towards further augmenting our healthcare systems through a paradigm shift of policies and overarching programs like the Pradhan Mantri Jan Arogya Yojana and Atmanirbhar Swasth Bharat Yojana. A new thinking is taking shape with the establishment of the National Medical Commission, Nursing Commission Bill, and National Commission for Allied Healthcare Professions Bill. Ambitious plans have been made for expanding medical colleges and revamping the health infrastructure in India. We are constantly working to revolutionize the delivery mechanism of healthcare services in the country. All of our endeavors can greatly benefit from the support and assistance of associations like GAPIO. Facilitating exchange of ideas and knowledge will not only help formulate best practices but also expedite their implementation, which will ultimately benefit society. On that note, I would like to congratulate all GAPIO award winners for their outstanding work and would like to extend my best wishes for success of this landmark Global Indian Physicians Congress that will further steer our medical workforce towards excellence. Thank you all for giving me the opportunity to address this esteemed gathering.
Thank you very much, Mr. Minister, sir, Dr. Harshvardhan, for your words of wisdom and guidance. Congratulations to the government's efforts in controlling the pandemic, as well as making India the leading hub for the manufacture of the COVID-19 vaccines, and simultaneously micromanaging the overall health of the country. Ladies and gentlemen, the moment is here now that we've been eagerly waiting for. The Global Association of Physicians of Indian Origin is very proud to honor and celebrate the achievements of some distinguished persons and doctors as we proudly announce these awards. I must remind you that an independent jury decided the winners, and we are delighted today to honor 11 worthy and distinguished persons. In the distinguished category, each award winner receives a trophy, a citation, and a cash component of 100,000 rupees. I'd like to start off by requesting Dr. Sanku Rao, gastroenterologist at Oklahoma, USA, and past president of the American Association of Physicians of Indian Origin, AAPI, and GAPIO, to please announce the winner of the Dr. Pratap C. Reddy Philanthropy Award.
Thank you. This is my distinct pleasure to announce the winner of Dr. Pratap C. Reddy Philanthropy Award, Mr. Praveen Agarwal. Congratulations, Mr. Agarwal.
Mr. Praveen Agarwal started his journey as a businessman more than 40 years ago. His two business ventures, Sterlite Power and STL, are pioneers in power and data transmission products and solutions with a global presence in over 90 countries. Since its early days, Mr. Praveen Agarwal has been a firm believer that it's all about giving back to society. He founded the Praveen Agarwal Foundation with the mission of making pediatric liver transplants accessible and affordable to all. The primary goal of the program is to provide just and equitable access to transplantation to children and young adults who need transplantation but lack the economic means. Patient empowerment is a key secondary goal that will be met by this program. The TPAF model has been recognized widely in India and abroad, with Mr. Agarwal having been recently felicitated and honored at Masterclass in Liver Disease 2020 by the Liver Transplant Society of India. One of his other initiatives, the STL Foundation, has also been relentlessly working towards transforming lives through efforts in technology and sustainable manufacturing. The foundation has various pilot projects focusing on education, skilling, healthcare, and sustainability. Going forward, he strives to touch many more lives through his various philanthropic activities.
Congratulations, Mr. Praveen Agarwal, for this prestigious award, the Dr. Pratap C. Reddy Philanthropy Award. And thank you, Mr. Sanku Rao, for having announced that. On to the Dr. I.A. Modi Award. I'd like to request Dr. Ramesh Mehta, pediatrician at UK and founder and president of the British Association of Physicians of Indian Origin, and the immediate past president of GAPIO, to please make the announcement.
Thank you very much, Dr. Khanna. I am delighted to announce the winner of Dr. I.A. Modi Award. The award goes to Dr. Rohini Handa.
It's an incredible honor to be conferred the Dr. I.A. Modi Distinguished Clinician Award. I would like to thank the Global Association of Physicians of Indian Origin for this singular recognition. At the same time, I would like to thank the different institutions that have played an important role in shaping my career. My alma mater, Government Medical College, Patiala, where I acquired knowledge. The All India Institute of Medical Sciences, Delhi, where I gained wisdom. And now the Indraprastha Apollo Hospital, where I could successfully start a rheumatology training program. Last but not the least, I would like to acknowledge my patients who, through their suffering, fortitude, and even death, taught me the lesson invaluable for every doctor: humility. Thank you very much for this privilege.
Congratulations, Dr. Rohini Handa, for that achievement. For the Gapio Excellence in Diagnostics Award, may I request Dr. Suresh Reddy, interventional radiologist at Chicago, USA, and the immediate past president of AAPI, to please announce the winner.
Thank you. Good morning and good afternoon and good evening. Thank you, Ms. Rini. It's my honor and privilege to announce the winner of the Gapio Excellence in Diagnostic Award to Dr. Naveen Dung. Congratulations, Dr. Dung.
Recipient of the prestigious Dr. B.C. Roy National Award bestowed upon him by the President of India, Dr. Naveen Dung is an alumni of Modern School and University College of Medical Sciences, Delhi, PGI Chandigarh, and All India Institute of Medical Sciences. Along with his wife, Dr. Manju Dung, who is a pathologist, Dr. Naveen Dung started his practice of lab medicine from very humble beginnings in the year 1985. He started this journey with a vision to make a difference, to dispel the myth that quality healthcare and diagnostics does not exist in our country. He had a conviction that diagnostics was as important as therapeutics, but it had never been given its due importance and was always considered as a behind-the-scenes specialty. With the motto of focus on the patient and treating every sample as not only a sample but a patient, with quality personalized care, ethics, and cutting-edge technology being the main pillars of his practice, Dr. Dang's lab has evolved to be one of the most trusted and respected names in India and has touched the lives of lakhs of patients. With many firsts to his credit and having authored many publications in international and national journals of repute, Dr. Dang continues to work tirelessly with many philanthropic organizations to bring relief to the needy. It may have been the H1N1 pandemic of 2009 or the recent COVID-19 pandemic of 2020. Dr. Dang's lab continues to work with the government whenever required. Dr. Dang's lab is now a family of more than 200 employees with his next generation of 2 children who are both young and dynamic pathologists, now being passed the baton of carrying forward the legacy of Dr. Dang's lab based on the same principles of personalized human touch, quality, cutting-edge technology, and ethics for which the lab is known for. Truly a family of pathologists caring for yours.
Thank you, Dr. Suresh Reddy, for announcing that award, and congratulations to Dr. Naveen Dang. I'd like to now request Dr. Professor N.K. Ganguly, former Director General, Indian Council of Medical Research, and the President of Apollo Hospitals Educational and Research Foundation, to announce the winner of the Gapio Karl Storrs Surgical Excellence Award. Dr. Ganguly
is mute.
Greetings and thank you, Rini. It's my privilege and honor to announce the winner of the Karl Storrs Surgical Excellence Award, Venerable Dr. Malligale Ramakrishna Girinath. Congratulations.
Dr. Girinath was born at Chennai in 1939. He grew up in Ahmedabad and schooled at St. Xavier's High School. He's one of the senior-most cardiac surgeons in India. He did his MBBS, MS General Surgery and MCH in Cardiothoracic Surgery from the All India Institute of Medical Sciences, New Delhi between 1958 and 1969. He was privileged to work for 2.5 years as a registrar in the unit of one of the greatest cardiac surgeons of his time, Sir Brian G. Barrett Boyce at Auckland, and was inspired to bring the acquired knowledge and skills back home to India. After working in Auckland, he obtained the FRACS from the Royal Australasian College of Surgeons in Melbourne. He joined Dr. Nemish Shah at the Bombay Hospital and the Sir J.J. Hospital and together did some pioneering work in pediatric cardiac surgery. He joined Southern Railway Hospital in 1975 and pioneered complex pediatric cardiac surgeries and coronary bypass surgeries. He joined Apollo Hospitals, Chennai in April 1984 and in the following years helped establish Apollo as one of the leading referral centers for cardiac care, having done 60,000 cardiac operations, of which 40,000 have been CABGs, and of these, 19,000 were off-pump or so-called beating heart operations, one of the largest series in the world. This child with a large VST, severe PAH and CHF was operated upon at 6 months of age, and on the right you see her at her wedding 20 years later. These X-ray pictures show a double valve replacement done in 1978. That's 42 years ago. These photographs are pictures of 4 of the patients who had undergone coronary artery bypass graft surgeries in the late 1970s. This photograph of immediate post-operative patients was taken at the time the first heart transplant was done at Apollo Hospitals, Chennai in 1995 and shows the range of cardiac surgeries done at Apollo Hospitals, Chennai. The transplant patient is a second from the left and survived for 14 years. This group photograph shows some of the 30 cardiac surgeons who trained at Apollo Hospitals, Chennai. This slide lists a few of the awards conferred on Dr. Girinath.
You can't see it inside. Purvi is coming. You will miss it.
Congratulations to Dr. Malligale Ramakrishna Girinath, and thank you, Dr. Ganguly, for announcing that award. Dr. Girinath is also the winner of the Surgical Excellence Award, and he gets an endoscope courtesy of Karl Storrs. I'd like to now invite Dr. Sudhakar Janalagada, an American board-certified physician in internal medicine and gastroenterology, and practicing in Georgia, USA, the current president of AAPI USA, to announce the winner of the Gapio Lifetime Achievement Award.
Dr. Unmute
Dr.
yourself.
Janalagada.
Thank you, Ms. Renikana. Greetings to all from United States. It's my honor to announce the winner of Gapio Lifetime Achievement Award is Dr. V.S. Natarajan. Congratulations.
Dr. V.S. Natarajan, this small-framed, gentle-mannered personality is a giant in the field of geriatrics. He was born in Shankarapalayam village in Periyar district. Hailing from a rural agricultural family, he had his initial school education in the Andiyur government school. After completing his MBBS from Madurai Medical College, he went on to complete his MD from Madras Medical College. Dr. V.S. Natarajan was the first Indian to undergo training in geriatric medicine in the UK. He received the MRCP degree and attained accreditation as a specialist in geriatric medicine. He is the pioneer in establishing an outpatient wing in geriatric medicine in Madras Medical College and Hospital, Chennai. In the year 1986, he became the first person in India to be appointed as professor of geriatric medicine at Madras Medical College. Recipient of the most coveted medical award, the Dr. B.C. Roy National Award in 1994 for the development of geriatrics. The British Geriatric Society conferred him with a 50th anniversary gold medal in London. He was awarded the Padma Shri Award in the year 2012 for his exemplary services to the elderly for more than 3 decades. Geriatric House Call project, where elders are treated at their own residences, were his brain waves. And also authored more than 30 books related to elders' health. An ardent devotee of Adi Parashakti and His Holiness, Arul Thiru Adigalar, he serves the rural elderly of that region through his services at the Mail Marvattur Adi Parashakti.
Thank you, Dr. Jinalagadda, for announcing that award, and congratulations to Dr. V.S. Natarajan. May I now request Dr. Anupama Gotimukula, pediatric anesthetologist at Children's Hospital of San Antonio, Texas, USA, and currently the president-elect of AAPI, to please announce the winner of the Gapio Special Appreciation Award.
Thank you so much, Rini, and greetings to all the dignitaries across the globe. It's my honor to announce the winner of the Gapio Special Appreciation Award to Dr. Madan Mohan Reddy.
May I request the kind presence of Dr. Madan Mohan Reddy, an inspiring orthopedician, ladies and gentlemen, joining us as we celebrate Doctors' Day Conclave, along with the entire team of the Economic Times. Dr. Madan Mohan Reddy,
most promising orthopedic surgeon in Chennai, and the award goes to Dr. Madan Mohan Reddy.
Thank you, Dr. Gotimukula, for announcing that award, and congratulations to Dr. Madan Mohan Reddy. So congratulations to the winners in the distinguished category. We now move on to the young category, and the award winners in this category get a cash component of 50,000 rupees, a citation, and a trophy. I'd like to start off by requesting Dr. Bhupinder Sandhu, pediatric gastroenterologist, recognized with an award of the Officer of the Order of the British Empire, OBE, in the UK, and a member of the Executive Committee of Gapio, to please announce the winners of the Dr. I.A. Modi Award. You heard it right, winners. So we have joint winners this year for this award.
It's my real pleasure and honor to announce the winners of the Dr. I.A. Modi Young Clinician Awards. The award winner is Dr. Sonali Khobragade from Nagpur. Congratulations, Sonali. And the second winner of the I.A. Modi Award is Dr. Purvi Parakh from New York. Congratulations, Purvi. And I'm particularly delighted that 2 women are winning this Young Clinician Award.
Thank you very much, Dr. Sandhu, and congratulations to Dr. Khobragade and Dr. Purvi Parekh. I'd like to now call upon Dr. V.K. Raju, an ophthalmologist at Regional Eye Associates, USA, president and founder of the Eye Foundation of America, and the founder-president of Gautami Eye Institute, India, and member of the Executive Committee of GAPIO, to please announce the winner of the GAPIO Excellence in Diagnostics Award.
Thank you, and I'm very glad to be here during the COVID Mahamari era. This award, this is the winner of GAPIO Excellence in Diagnostic Award in the Young category, goes to Dr. Nishad Hussain Ahmad. Congratulations.
Thank you, Dr. Raju, for announcing that award. Congratulations to Dr. Nishat Hussain Ahmed. May I now request Dr. Bal Reddy, family physician and diabetologist at Hyderabad and the former secretary and president of the Andhra Pradesh Private Hospitals and Nursing Homes Association, comprising 5,000 hospitals and nursing homes, and a member of the Executive Committee of GAPIO, to please announce the winner of the GAPIO Excellence in Radiology and Radiation Therapy Award.
Dr. Balareddy, just unmute yourself, please.
Thank you so much, Mr. Reddy. The winner of GAPIO Excellence in Radiology Radiation Therapy Award is Dr. Sushavan Banerjee.
Could we have the right slide on, please?
Pardon me?
Could we have the slide for Dr. Sushovan Banerjee on, please? Okay, I'm sorry for that technical glitch that we had. We were not able to see Dr. Balareddy, but if we have the right slide here, no, this is still Dr. Ahmed. Dr. Sushovan Banerjee slide, please. Congratulations to Dr. Sushovan Banerjee. We're moving on now to the next award, and I'd like to request Dr. Ravi Kolli. Okay, we've got the right slide on now. Radiation Oncology. Dr. Sushovan Banerjee, who operates at Medanta Medicity. Congratulations. Dr. Ravi Kolli, if I could request you, sir, psychiatric medical director at Southwestern Pennsylvania Human Services and the vice president of AAPI USA, to please announce the winner of the GAPIO Karl Storrs Surgical Excellence Award. Dr. Kolli.
Thank you, Ronnie. I want to applaud GAPIO for the excellent services they have been providing in the past year during the COVID educational seminars. And now it's my distinct honor to present to you GAPIO Karl Storrs Excellence in Surgical Excellence in Young category, a smart and dynamic doctor, Dr. Babu Garg. Here is Dr. Garg.
Thank you, Dr. Kolli, for announcing that award, and congratulations to Dr. Bhavuk Garg. Thank you, doctors, and congratulations to all the winners. I'd like to now call upon the renowned allergy and immunology specialist, chairman and publisher of Parekh Worldwide Media, an ITV Gold 24/7 TV channel in the USA, and the Secretary General of GAPIO, Dr. Sudhir Parekh, to please propose the vote of thanks.
Thank you, Rimi Khanna. Dear friends, good morning, good afternoon, good evening. It's my privilege to do the vote of thanks. Honorable Minister Dr. Harshvardhan, founding chairman Dr. Pratap Reddy, current president Dr. Anupam Sibal, all the delegates, all the participants worldwide. I am Padma Shri Dr. Sudhir Parikh, proud to be a part of the Global Physician of Indian Origin, a great organization with a mission to bring 1.4 million physicians of Indian origin on one professional platform. GAPIO congratulates wonderful award winners today who have proved their mettle in the healthcare through their hard work and dedication. Let's give them a big round of applause to appreciate their hard work. Also, I would like to thank our Honorable Prime Minister Narendra Modi for his best wishes and support to the GAPIO. Thank you, Honorable Health Minister, for your excellent support and guidance. I would like also thank our Chairman, Dr. Pratap Reddy, Dr. Anupam Sibal, Dr. Anil Tandon, and all our past president, as well as API President Dr. Sudhakar Janagadala, President-elect Anupama, and past President Dr. Suresh Reddy for their commitment and dedication for this GAPIO initiatives. We thank a great audience from all over the world, all the delegates and participants. Last but not the least, I would like to thank members of media to propagate our great initiative and all other organizations who are supporting us, as well as all the sponsors who made this whole Congress possible. God bless GAPIO, God bless India, God bless all Indian physicians outside India and India for their great work. Jai Hind, and thank you very much.
Thank you, Dr. Parikh. Ladies and gentlemen, before we close the award ceremony, I would like to just share a couple of important announcements. All participants who've tuned in are advised that the next mid-year conference of GAPIO will be held on a virtual platform on the 7th and 8th of August, 2021, and the next annual conference of GAPIO will be held on the 12th and 13th of February, 2022, that is next year, at Kolkata. Thank you once again for joining us for the award ceremony. Congratulations to all our distinguished and young winners. Do remain with us as we continue with the next session on leadership mantras in the same auditorium, moderated by the President of GAPIO, Dr. Anupam Sibal.